Hi everyone. In the earlier video, we have seen that the loop diuretics and thiazide diuretics causes loss of the potassium ions. So that will result in hypokalemia. Potassium sparing diuretics are the drugs which are used to prevent this side effect of loop diuretics and thiazide diuretics. So potassium sparing diuretics are going to prevent the side effects of the loop diuretics and thiazide diuretics, that is hypokalemia. So let us discuss the potassium sparing diuretic in detail. Potassium sparing diuretics are the aldosterone antagonist and renal epithelial sodium channel blockers. Aldosterone antagonist include spironolactone and eplerenone. Renal epithelial sodium channel blockers include triamterene and amiloride. So first let us discuss about the aldosterone antagonist, that is spironolactone. Spironolactone mainly acts in the collecting duct, and this drug prevents the conversion of the receptor to the active form and prevent the action of the aldosterone. So aldosterone normally binds with the intracellular mineralocorticoid receptors, and that will induce aldosterone induced protein, which is responsible for the sodium reabsorption and potassium secretion. Now spironolactone is a competitive antagonist of the aldosterone, and that will result in inhibition of the action of aldosterone induced protein. So in the absence of the aldosterone, spironolactone action will not occur. So spironolactone ultimately increases the sodium excretion and decreases the potassium excretion. So this is its potassium sparing effect. Now coming to the pharmacokinetic property of the spironolactone, it is orally given, it has extensive first-pass metabolism and some enterohepatic circulation. Spironolactone is a prodrug and it is converted to the candrenone, which is its active metabolite. Now spironolactone is a weak diuretic, so this is used basically for the prevention of the potassium loss, which is caused by the thiazide and loop diuretic in case of the hypertension. Spironolactone is also used in case of the congestive heart failure, as it retards the mortality and disease progression. Spironolactone prevents the pathological remodeling which occurs in case of the congestive heart failure. Spironolactone is also used in case of the cirrhotic and nephrotic edema, and it is also used in the treatment of the primary hyperaldosteronism, where there is a raised level of the aldosterone in the body, and this is also known as Conn's syndrome. So this was about the therapeutic uses of the spironolactone. Now coming to the side effects of the spironolactone, this includes hyperkalemia, and you have to avoid excessive potassium supplement when you are giving the patient spironolactone. Also, you have to avoid certain drugs which can result in hyperkalemia, such as the ACE inhibitors and angiotensin receptor blockers. Spironolactone can also result in gynecomastia and menstrual irregularities, GI disturbances, and spironolactone is contraindicated to use in the patients of peptic ulcer. Now coming to the renal epithelial sodium channel blockers, which includes triamterene and amiloride. So these drugs acts in the collecting duct. You can see in this figure that amiloride, it acts on the renal epithelial sodium channel, which is also known as amiloride sensitive sodium channel in the collecting duct, and this drug decreases the potassium excretion and enhances the sodium excretion. Now coming to the therapeutic uses of the amiloride and triamterene. So these drugs are basically used with the thiazide or loop diuretics to prevent the hypokalemia, and these are used in case of the edema or in case of the resistant hypertension. Then it is also used in cystic fibrosis, as amiloride decreases the respiratory secretions in these patients. Lithium induced diabetes insipidus. Amiloride blocks entry of the lithium through the sodium channels in the collecting duct cells. Amiloride is a drug of choice for the lithium induced diabetes insipidus. So this was about the therapeutic uses of the amiloride and triamterene. Now coming to the side effects, these drugs can cause hyperkalemia. So you have to avoid potassium supplements when you are giving this drug to the patient. Triamterene is a weak folic acid antagonist. So it can result in megaloblastic anemia in the cirrhotic patients. It can also result in photosensitivity, reversible azotemia, and nephrolithiasis, which is known as renal stones. Now coming to the drug interactions of the triamterene and amiloride. These drugs you should not combine with the spironolactone, ACE inhibitors, or angiotensin receptor blockers because these drugs are also having a potassium sparing effect. So these can result in additive hyperkalemia. So to summarize about the potassium sparing diuretic, so spironolactone is a competitive antagonist of the aldosterone. This ultimately results in increased sodium excretion and decreases the potassium excretion in the urine. Amiloride is a renal epithelial sodium channel blockers and that also increases the sodium excretion and decreases the potassium excretion in the urine. So these drugs are basically used to prevent hypokalemia, which occurs due to loop diuretics or thiazide diuretics. Spironolactone is also used in case of the congestive heart failure. Adverse effects of the spironolactone include gynecomastia, menstrual irregularities, and potassium-sparing diuretics can cause hyperkalemia as a side effect. Amiloride is a drug for the treatment of the lithium-induced diabetes insipidus. So this was about the potassium sparing diuretics. If you like this video about the potassium sparing diuretic, subscribe my channel and follow for more pharmacology related videos. Thank you.